Hi all, it's such a pleasure to be here with you today. My name is Eliza Philbin, and I'm a senior here at the University of Florida, and I hold the position of Vice President of Media for the Association for Media Professionals, or as we call it, AMP. I'm so honored to be co-hosting this event with Howard University, and I will be introducing our University of Florida alumni. Kamelya Hinson is a Senior Health Communications Specialist for the Division of Strategic National Stockpile in the U.S. Department of Health and Human Services. She previously was on the social media team in the digital media branch at the Centers for Disease Control Prevention. Currently, Hinson is working on the ongoing COVID-19 response, which includes responding to public requests for information, news media inquiries, and managing digital media. Hinson graduated from the University of Florida with a degree in telecommunications and credits her continued success on the relationships built through the Gator Nation. Hinson currently serves as the president of Atlanta Gator Club and serves as a mentor for UF's Association of Black Alumni's Atlanta chapter. In 2019, she was honored with the coveted University of Florida Alumni Association's National Leader of the Year Award. Her favorite college memories are singing in the UF Gospel Choir, doing community service at senior living facilities as a Phi Beta Sigma sweetheart, and serving as UWFT Associate Producer for the annual Gator Growl Homecoming Parade. I'd also like to introduce Ernest Hooper. He serves cancer patients, survivors, thrivers, and supporters as the Regional Communications Director for the American Cancer Society's Southwest Florida Division, promoting the nonprofit's mission in 11-county region centered around Tampa Bay. Prior to joining the society, Hooper worked for the Tampa Bay Times for 27 years as an editor, columnist, and writer. Hooper is also in his sixth season as a host of the public affairs television show, That's All I'm Saying, on PBS. He's the co-host of Dishonorable Mention, a podcast focused on politics and entertainment. And he co-leads the Right Field program, a writing intensive for middle school and high school boys at the Poynter Institute of Media Studies in St. Petersburg, Florida. Hooper also writes community columns for the St. Pete Light magazine. Now I will introduce Deasia, my co-champion, who will introduce our Howard alumni.
Thanks, Eliza. Hi, everyone. My name is Deasia Lamar. I am a senior public relations major, biology minor from Howard University, and I serve as this year's Howard University Public Relations Student Society of America historian. And I'll be introducing our Howard University panelists for today. So our first panelist is going to be Dr. Isa Miles. Dr. Isa Miles is a senior communications advisor in the HIV and prevention branch of the Division of Global and HIV and TB at the Centers for Disease Control and Prevention. She brings quite a unique combination of expertise and experience in health communication, behavioral science, community-based participatory research, and epidemiology to her work, which is primarily focused on translating technical public health research findings into meaningful messages and strategies to encourage health promotion and disease prevention among non-scientific audiences. Throughout the course of her career, Dr. Miles has developed and led innovative projects and research on a wide variety of topics, including HIV and AIDS prevention, violence prevention, concussion prevention, physical activity promotion, breastfeeding promotion, women's health, adolescent health, breast cancer prevention, and smoking prevention. Dr. Miles graduated from Howard University with a degree in mathematics and went on to the Harvard School of Public Health to obtain her MS and PsyD in epidemiology. She completed a Kellogg postdoctoral fellowship in community-based participatory research at Johns Hopkins Bloomberg School of Public Health and is a former epidemic intelligence service officer at the CDC. The next panelist that I'll be introducing today is Juanita McLeod. Juanita McLeod is a communications specialist who works for the Office of Equity, Diversity, and Inclusion at the National Institutes of Science. She is a dedicated champion of diversity and inclusion and developing messages for a series of various tactical inclusion initiatives, campaigns, and program launches for the NIH. McLeod holds her Bachelor of Science in Mass Communications from Howard University and a Master's in International Marketing from the University of Maryland. Lastly, I'll be introducing our HU moderator, Ms. Kirsten Allen. Kirsten Allen currently serves as the Communications Director for the Select Subcommittee on the Coronavirus Crisis at the U.S. House of Representatives. Allen, who is originally from Alameda, California, graduated from Howard University with a degree in public relations and is a seasoned communications professional and campaign operative who has advised and directed strategy for elected officials, campaigns, and candidates at the federal, state, and local level. Previously, Allen served as the Deputy National Press Secretary for Senator Kamelya Harris's presidential campaign, where she was involved in developing national media strategy and led African American media outreach and engagement. She got her start in electoral politics, serving as regional press secretary for Hillary Clinton's presidential campaign in Florida, and went on to serve as the senior communications team for Mayor Andrew Gillum and Mahlon Mitchell's gubernatorial races in Florida and Wisconsin, respectively. Allen last served in the House of Representatives as communications director for Representative Bonnie Watson Coleman of New Jersey. Now I'll turn it over to Ms. Kirsten Allen.
Thank you so much, Deja, and thank you all for joining us today. It's an exciting time and an appropriate time to definitely be talking about healthcare communications. I wanted to kick it off with a question that I am going to throw at Ernest about career choice. I think all of students, when you were students, everyone thinks that like this degree that I'm going to get is going to take me through the rest of my life. And sometimes that is not how it operates. So I wanted to ask you specifically, Ernest, your career path and how you got to where you are now as a nonprofit communications professional.
Well, thank you for that question. And I did spend my entire career as a newspaper journalist, but along the way, I made sure to acquire some added skills. Continuing education is so important. And I think those two things, the added skills as well as my foundation as a writer, made it, allowed me to make the transition to being a communications director for a nonprofit. I like to tell young people that it's so important, first and foremost, to be an adept writer. And if you have great writing skills, you'll be able to find a job in the market. There are so many different companies that are in need of people who can communicate through the written word. In addition to that, you have to add to your tool belt. You need to be able to edit video and record video. You need to be able to do some web design. Adding those, you need to have an understanding of the new emerging social media platforms. So all of those things can help you, whether you choose to go into journalism or some other field. It's about your skill set.
Amazing. Thank you, Ernest. The four of you, well, the five of us are all communications professionals in the healthcare field amid a global pandemic. All of us, if it wasn't clear, are Black men and women who, before this pandemic, knew, whether personally or just by proximity, the impact of health disparities in this country. America's history has rightly fueled a fear of vaccines and healthcare. Twice this week, as Deja pointed out, we've heard that two companies, Pfizer and Moderna, have said that data on its corona vaccine candidate showed that it's highly effective. But recent Pew research has shown that only 72% of Americans would probably or definitely get a coronavirus vaccine if it were available. That figure is even lower for Black Americans, and it's around 54%. Kamelya, I'm going to ask you, because this directly impacts your work, what should outreach and engagement strategy look like to address the doubt, but also increase trust in a forthcoming vaccine?
Well, for starters, CDC has always had challenges convincing people just to get the flu shot. So, and that's outside of a pandemic. So you can imagine how hard it's going to be to regain the trust of the American people that want to try to combat this. So I feel like the best strategy is sort of like what Amy said in the chat, as far as she'd like to wait and let a few people. I hear a lot of people saying that. I even feel that way, and I'm kind of just a little bit on the inside, never all the way on the inside. So I feel like a good strategy would be to work to develop the trust first and be consistent and transparent in your messaging and make sure that all of leadership is on the same page and they are presenting. There was a time during Ebola crisis where all of leadership got together and they did those press conferences together, and we all heard the same messaging and everything was consistent, and the administration got behind it. So a strategy would be transparency and consistency. And I also feel like they should probably get those groups, those 30% that are interested in taking the vaccine, and let's follow them on a journey. Let's get a diverse group of influencers. That's something that the government doesn't always like to work with. But if we got a diverse group of influencers to follow this path along and actually work with them and let the public see how that vaccine worked. And I feel like it would be a good way to step. So do everything consistent, be transparent, and just make sure you communicate in plain language. Plain language is definitely a key in this as well.
Absolutely. I think also a little bit of what you're saying is also knowing cultural competency, right? And knowing who your audience is and making sure that you're not only just touting whatever it is, what should be a rollout of a vaccine, but understanding that it's about instilling public trust.
Absolutely. And we've got to own it. We've got to own it. And we got to come clean about it. We know you don't trust us. So we want to walk through. We're going to take you by the hand and walk you through this. We're not going to just take this vaccine and throw it in your face and make you take it, because they're not going to take it.
Exactly. Dr. Miles, I'm going to head over to you in the vein of cultural competency, but also how does health literacy play a role in your ability to communicate these issues? And what tips have you found useful in the creation of healthcare campaigns that are targeted to specific audiences, whether it be minority audiences, LGBTQ plus communities, or even our Native communities across the nation? How does health literacy play a role in your ability to communicate?
Absolutely. So I think, when I think about health literacy, so often I think about we have this expectation for the public to meet us where we are, rather than us meeting them where they are, right? So we talk about health literacy, but think about it. How does anyone have health literacy? Has anyone taken a class, if that wasn't your major in college? Is there any time in middle school, high school, where we sit around and we talk about health and we talk about how to understand when people deliver messages to you? So often we want to deliver statistics to people. We want to say 25% of Black Americans living in the Southeast are more likely to have blue nose disease, whatever it is. And we want people to be able to process that information when this is not how they speak on a regular basis. So for me, when I think about how do we reach people, I say, let's try to make the messages as simple as possible so that people understand them, because people do talk about health. They just don't talk about it using the same words and languages that we may use in public health. When I talk to scientists and physicians, one of the things I always tell them is to avoid what I call the scientist trap. And that trap is, again, we want to give you technical terms, we want to throw statistics at you, because that's what matters to us. But that's not what matters to most people. What matters to them is making it real, making it something that they can relate to. And so it's our job to do that. So as you asked me about campaigns or messages for certain communities, a big part of that is about, one, building trust. As Kamelya was just saying, it's so important to build that trust, to engage them in helping us understand, what is it about this piece that matters to you? For example, if I want you to exercise because heart disease is what matters to me, maybe heart disease doesn't matter to you, but what matters to you is having a mental stress break every day. Either way, it gets you out and walking, right? So I win, you win. So why don't I develop messages about mental health and a stress release, or getting out and having some fun with your girlfriends? So it's really about engaging communities, understanding things that resonate with them, and being true to that and speaking in a language that people understand and are willing and ready to receive.
I think what you said is not only poignant, but it also reminds me, I think sometimes we often think about healthcare when we get sick. and not holistically, in that everyone is a patient, right? Everyone has the potential to be a patient, whether you are healthy or sick, or, you know, have health challenges. And so I think about that in the context of not only this pandemic, but also going, you know, beyond. Like, some of you are doing work with cancer, as Ernest is, and some of us are doing work with HIV. Research demonstrates that the existence of bias in not only healthcare providers, but also the healthcare system writ large, impacts minority communities the most. Health disparities are real, as we talked about earlier. What specific steps need to be taken in order to circumvent this? I know it was announced that I used to work for Senator Harris, then Senator Harris, VP-elect Harris, and one of the issues that she took very personally and championed was maternal mortality, because there are a lot of disparities in the deaths of Black women giving birth. Juanita, what specific steps do you think need to be taken in order to not only minimize disparities in healthcare writ large, but what can people do not only as patients, not only as healthcare providers, but as patients as well? We can't hear you. Can you unmute?
I thought I unmuted myself, and we practiced so much. I apologize. But I was saying, I'm glad that you brought the pregnancy mortality rate up, because I think a celebrity that shed some light on that was Serena Williams and what's his name? The singer and his wife. I've lost my train of thought. John Legend. Thank you. They shed some light on that. And I think the first step in indicating disparity in healthcare is admitting that there's disparity in healthcare and making that known and getting organizations to admit that there is disparity. And there's a lot of ways.
I think you muted yourself again.
Can you hear me now? I'm sorry. Okay, I'm sorry. I don't know what's happening. But I was saying with Dr. Miles and Ms. Hinson, making it plain. And there's been like evidence. I'm a strong advocate for positive propaganda. And, you know, both of them earlier said that making it plain. If you speak too high level, you're going to miss a swath of Americans, right? And so there's different levels and different ways we can communicate. And first of all is communicating to the public. And there's been studies that have shown that minorities have learned a lot through entertainment education. TV shows. I'm a fan of This Is Us. And I love that This Is Us is now talking about mental health in the Black community and mental health in the Black male community, and how important it is for us to have more representation within this industry, within this field, to help circumnavigate all of the biases and myths. Another step I think that is very important is training within the staff or within the organization. People, I think mandatory bias training is necessary. It might not be received well. It might not be, there might be some reluctancy towards taking the course. But once the course is being taken, there might be an aha moment for some. There might be a revelation for some that they didn't realize that they've had. I also think that another step beyond that is getting the word out that there's jobs that need to be filled in this industry so they can have more representation, because there's cultural differences too, right? So it's not just race relation differences, but diversity, it crosses so many boundaries and lifestyles and the whole gamut. So if we have more representation, there's more empathy, right? We don't want someone's sympathy all the time. We want some empathic, professional guidance. And I think it's so multi-leveled. You need to reach the public with your messaging, really plain, really clean. You need to reach your client relation, like exit surveys. How is your experience as a client here or as a patient here? Did you feel, taken care of? Were your needs, like I brought up Serena Williams, she said she had to implore like over and over again, like something's wrong. And me personally, not to put my personal experiences out there, but I went through the exact same thing, and I was in a lot of pain, and I got dismissed, and I got told that I was feeling it was in my head. So that's a real thing, and I was in a lot of pain. So I think it's multi-leveled, and I think as communicators, we can kind of bridge that gap for professionals in the scientific realm, or as a professional realm, as the doctors and the researchers and the scientists. And we can have a more baseline approach and say, look, I'm on the outside looking in on you guys because you're the scientists, but I'm telling you what's going on out in the field. Let's work on some communication efforts to help close those gaps, close those loopholes. And again, even with HR, let's hire some professionals that can be more empathetic to the clients.
I think that you said all of the things that I'm thinking through, not just in healthcare, but I know we're all here to also discuss our experiences in communications and the communications field. And I will say that before I made the transition kind of into the healthcare field through the select subcommittee, I was in campaigns a lot, and there's very few of communicators that look like this panel. And that will continue to be the case until it isn't, right? And until we, demand and make space for those who are coming up behind us. I recall one specific incident where I had, had a resume that had a host of experience. I've worked in states across the country, and one of the potential employers said, hey, we want you to do constituency comms. And I was like, well, what does that mean? And they were like, well, we want you to talk to the African American media, and we want to make sure that you're doing engagement with Black people. And I was kind of like, yeah, I mean, obviously, but when I talk and communicate, I'm talking to Black people as well as everyone else, right? Mm-hmm. Not just, part of my strategy, part of your organization strategy should always include constituencies. So I want to know, and I'm going to go to Kamelya. Have you ever heard that you have been put in charge of or given a project based purely on being women, and not because you were qualified people and an amazing talent? And how did that make you feel? How did you handle that?
Well, I could not say I have been put in charge of something because of my race. And I really feel like the CDC leadership kind of prefers message testing. And it's very rare in my experience. Other folks that work in the feds may say something differently, but in my experience, they don't seem to rely on the health communicators of color for their expertise in color. And maybe they do that because they don't want to offend us. But there have been times when I have tried to interject an opinion, but they rely on what's in the data and they go with that. And even if you say, well, you may not want to say it that way, you may want to phrase it this way. And, who is your real audience? And, I personally don't feel that my opinion as a Black woman is considered. And I know I'm not the only one. Sorry.
Can I chime in on that if it's okay? So I absolutely agree. We rely so heavily on the message testing, and I think that's important. I can't say that I've necessarily been put on a project to bring the Black voice, at least within the CDC space, but part of me wishes that I could be or was, because I do think our voice at the table is important. If you're rolling out a campaign for Black women, and there's not a Black woman sitting around that table, and
Right.
in the sphere of health, that matters. That matters. It's not about talking to everybody. It's about my lived experience gives me an additional qualification on top of my education to be able to insert thoughts into this conversation that other people around the table wouldn't think to think, because they haven't lived it and they shouldn't think it.
Absolutely.
But they're important, and those are some of the reasons we're missing the messages and the audiences we need to be reaching. Because as Kamelya said, like, they want to rely on the message testing, but we have to make sure we're asking the right questions in the message testing. And some of that is nuance. Some of that is, you need to ask if this word is right, not just do they like the concept. You need to ask, does it matter what her hair looks like in the image? You need to ask. I mean, I remember I worked on a project where there was a Black woman in charge, and one of the questions we asked was about imagery, and something that came back was like, people didn't like the way the lady's nails looked, and so they didn't want to connect, because her hand was pretty prominent. And they felt it was dated, it didn't relate to them. Well, that's something that someone else might not even think to pull out when you're doing testing, right? And so for me in health, as Juanita mentioned, I think it's important for us to get more people around the table who have lived experiences that will influence the way we're doing what we're doing.
Absolutely. 100%.
I wanted to kind of shift over, and Ernest, I'm going to pull on your amazing career as a journalist. One of the phrases that has permeated our discourse over the past 4 to 5 years has been fake news. And the spread of information continues to be a challenge. And that presents a huge problem for those involved in communicating guidance from public health experts and doctors. How have you and your organization, but also drawing on your career as a journalist, sought to combat information or respond to misinformation in real time? And what does that look like?
Well, when I worked at the Tampa Bay Times, we developed a Pulitzer Prize winning arm of our operation called PolitiFact that kind of revolutionized fact checking. And that is so important. And it was important to challenge the misinformation and point out what made it wrong. And we had, PolitiFact has a rating system where you could say mostly true, half true, or my favorite, pants on fire, which means the person is just outright lying. And so that's been replicated by other media outlets. That's a big piece of correcting misinformation. In my current role, I think we take a multi-pronged approach. Certainly, we try to get our story into different media outlets and get what we all call earned media. And I'm pitching TV stations, I'm pitching the newspaper to try to get them to share the American Cancer Society perspective on all kinds of different issues. At the same time, we have to do our own media. We have our own social media platforms. We have our own YouTube channel. In fact, we have a animated 5-minute illustration about health disparities on YouTube right now. I can put that link in the chat if you guys are interested. And it really illuminates what's happening in the cancer community in terms of health disparity. So it's taking advantage of all of these different ways we have of communicating. And I don't think you can leave any stone unturned. You have to try to get into the daily newspapers, the weekly newspapers, the historically African-American newspapers. You need to get your message out on Facebook, Twitter, Instagram. There's 3 or 4 others that I can't even remember right now, but you gotta try to deliver your message in as many ways as possible and to as many people in as many different audiences as possible. We need to use these social media platforms to reach young people and perhaps some audiences that aren't turning to traditional media. You mentioned representation on television shows, and that is another way to communicate, what's happening. But we have to be somewhat relentless in getting that message out there. For most cancers, African Americans have the highest death rate and the shortest survival rate for any ethnic group. That's a message that we need to get to the African American community in an effort to explain the importance of screening, to explain the importance of checkups. And during the pandemic, we saw the rate of screenings and mastectomies drop precipitously, particularly in March and April. It's rebounded a little bit, but we've been trying to get the message out to people to talk to your doctor and find out if you need to have that screening or if you need to have that mastectomy. We can't, cancer has our mantra now is cancer hasn't stopped, so neither can we.
I love that mantra. I am going to pivot a little bit and to ask you guys a little bit more about how you kind of got where you are, and less so about healthcare, but more so about communications. Dr. Miles, why did you decide to go into communications?
Yeah, so great question. I'm going to try to keep this as short as I can because it is a roller coaster with lots of twists and turns. But I actually, I started, if anyone was listening to my bio, my background and training is pure public health science. I'm a PhD epi and went into the field really from the side of public health. But as I was exploring in my career, I realized that I was much more intrigued by the what next. So, most of the studies end with there's this disparity, there's this issue, this is that, end of study, thank you for coming, are there any questions? And I'm like, no, it's the what next, what do we do about it? And so I spent a lot of time doing community-based participatory research and engaging communities, and then I got really intrigued with how do we deliver these messages back to communities? How do we actually make change? How do we not hold on to this, but engage with people in a way that makes sense and that they can understand? And as Juanita mentioned, entertainment education was one of the original things that piqued my ideas, piqued my mind and developing campaigns. And so in my sort of side life, I tell people I was a scientist by day, creative by night. I was doing a lot of stuff in film production and theater and sort of behind the scenes. That's always been something that I love. And so I thought, wait a minute, I could combine the two and not have to have them separate. And so as Ernest mentioned, I started, getting opportunities, gaining those skills in other ways so that I truly could become a communicator and a health communicator. But I didn't start as a communicator. It called me, and it's been sort of the best merger and the right place for me to do what I think I always wanted to do in public health.
That's amazing. I think one of the big pieces about entering this field is just having a wide range of experience. I know a lot of all of us, and a lot of when I was a student at Howard, internships were a big thing, but also leveraging those internships and the relationships you make there. Juanita, I think as someone who's doing D&I work and equity work, the global pandemic has shifted our workforce. We're on Zooms now, like this. We are, in some ways, because we are at home, there's no delineation between work and rest sometimes. And I actually was reading an op-ed on Blavity, and the author argued also that the death of brick and mortar, the death of going into the office, will unlevel the playing field for POC professionals. What are some ways students who are doing now virtual internships or new employees who have never met their colleagues before, how can they engage and find mentors and make connections in this new environment? And what not only should employees do, but what should employers be doing to make that process easier?
There's a few ways. While and I never thought I would say this. I do miss the brick and mortar now. At first, I thought this was glorious. But also being a mom, I'm like, I did not realize how much of my workspace was an escape space. So now I'm like, I go back to work, please. I miss my office. But beyond that, I think now with technology, and I'm from a generation where we didn't have social media, right? And I know there is good and there's the bad that comes with social media. But in our community, for the African American community, and just I think all communities can benefit from social media. I've seen there's been a bigger understanding, and even there's more collective a collectiveness between different groups in diversity that are coming together via these social media global connections. Correct, right? So I think this is a great opportunity. I always think of Black Twitter, because Black Twitter is not an isolated place. It's not a separate website. It's not a super link. It's not give me the link to Black Twitter. No, we're still in the same sphere, but we're a community within the sphere, right? But we're powerful, and I see if we can do that there, we can do that anywhere and on a digital scope. So finding mentorship is the same way of making yourself seen and known and reaching out to someone who you want to be, or you study that person, or you say, oh, that person is doing what I believe in, or that person is doing what I want to do career-wise, or that person is doing, and now we can reach out and touch them and say, I've been admiring you for XYZ. You got this many followers or this many hits, or you said this and it really touched me. How can I be like you? Or how can I, that's the beauty of, I think now, especially with the pandemic, we can use that as an excuse. So since I can't walk up to your office, I can be a little less formal and hit you in the DM and be like, hi, I admire you from afar. But when you ask someone to be your mentor, just be sure that you really studied that person and that your admiration is genuine and that you're really seeking their mentorship. And flattery gets you a lot of places. And I definitely think LinkedIn, I think a lot of millennials and Generation Z don't understand the value of LinkedIn. It's a great professional platform that kind of operates the same way as Facebook and Instagram and the other platforms. Not as informal, but it's a great way to be informal but still professional, and really seek people that you really want their mentorship from. I think it's a very useful tool, and I definitely, I always encourage young professionals, please use your LinkedIn the same way you do your Facebook and Instagram and TikTok and Snapchat and whatever you use it the exact same way, but in a more professional realm. And I think it's a great tool, especially during the pandemic.
Amazing. I'm going to give this question to everybody. So we'll start with Ernest and then go in a round robin. But a question we got in the chat from some of our participants was, what has been your experience as a person of color in communications?
Well, it's been a really interesting experience. They were talking earlier about having a seat at that table. And I think there are times where you want to be at that table and you want to give input. I know I have some colleagues who sometimes, and I understand this, they are bothered when an editor comes in and says, hey, we're trying to reach someone in the Black neighborhood, or we're trying to reach someone in the Black community to talk about this. And so part of you is, oh, now you need me. Oh, now you want to ask me. On the other hand, you're in a position to help. You're in a position to improve how the African American community is covered. So you can't let your ego cause you to dismiss that opportunity. And that was a big part of me making a transition from NFL writer to community columnist, because I saw that my institution needed help covering the African American community. And while my column wasn't exclusive to the African American community, I knew that giving up my dream job of covering the NFL and devoting myself to covering the community would in part allow me to help steer the paper's coverage of the African American community. So when you find yourself in that position, make the most of it. Make the most of being in that company and being at the table and having the opportunity to do a better job for the African American community.
Kamelya, would you like to tackle that question as well?
So the question was like, what is it like being a communicator that is a person of color? I mean, it's great when, with all things being equal, but all things are not equal. I would say that, you know, there's favoritism in the workplace. When the promotions come up, you see where they're going, and they tend to always go that way. And it is a challenge. And it seems that how much they like you at the end of the day, when it's time for that promotion, that promotion is going that way. And that's kind of been the experience. And it's sad to say, but at the same time, I'm very appreciative of just being in this field, because it wasn't, again, had intended on going into. I worked in nonprofit like Ernest. I was doing communications with Girl Scouts and trying to promote Girl Scout cookies and all of that. And that was always diverse, and diversity was always important. So it wasn't coming to the government and in the workplace. So you're dealing with the biases amongst your colleagues, and then you're dealing with trying to get messaging out. And then there's another bias. There's a bias against communicators. We struggle to get, in the scientific world, we struggle to get the respect of other scientists that feel like we're doing the bulk of the work. Like, who are you? Well, I'm taking all of this madness that you're giving me, and I'm trying to make it plain for you. Help me help you. It's just help me help you. And that's kind of what we find ourselves saying a lot. And so it's a struggle, and there's a lot of different cultures. I'm kind of rambling here, but these are struggles of the communicator, especially in that scientific realm. I deployed to American Samoa a few years ago for the Zika response, and within the Samoan culture. And it was just me, this little Black girl, and all these other white scientists, and they couldn't figure out how to connect with the Samoans. I'm like, well, this is what we need to do. They didn't want to hear what I had to say. You're a communicator. Who are you? You know, like, we're like at the bottom of the totem pole because you're the scientist, and so you know it all, and we don't know anything. But then when we go into the meeting with the director of health, and they go in there with all these fancy charts that they worked on all night, and that they didn't need my help. What is this? And he just handed it back to them. Then they wanted to hear from me. How can we make it simple? I said, the man wants posters at his airport. He wants to tell the ladies to go get tested for Zika. He wants the bottom line. He wants it in plain language. Even the director, you know, he's the director. You can't go to him with all these numbers and data. So even just being a communicator is a tough. I feel like y'all agree with me. I'm gonna stop right there because I could keep going.
Yeah, no, I think, and I see Nadia Cox in the chat, and she says, you know what, it's frustrating not letting the communicator communicate. And I think all of us have seen that. I think part of what helps is also finding a group of people. I think in all of my experiences, a lot of the people of color, whether it be in campaigns or in the workplace, have found each other and provided support for each other. Have read each other in, because I think all of us have experience where people accidentally left you off the chain, or forgot to invite you to the meeting, or, you know, called you in at the last minute because the roof's on fire, but you told them that the extinguisher 2 weeks ago was under the sink, and they forgot about that. So I think that, you know, the challenges not only span across our industry and our experience, but also just across many. And it's something that will have to change, and we will have to force change. So I think another question we got was, how can others or allies increase and support visibility for POC students and job seekers? And so, Miss Juanita, I'm going to go to you because that directly is your work.
Okay, so allyship is interesting to me. I think you first have to identify your own privilege. And me being a Black woman for a long time, I was like, I don't have any privilege. I'm Black and I'm a double minority. There's no privilege with me. And then taking bias training and learning more about diversity, I realized how much bias I actually do have. I am a cisgendered, heterosexual, able-bodied woman. And when you start to identify your privilege, then you can be an ally. So I think it starts there first. And you can't be an ally looking for kudos. Like, I'm a good person. I see a lot of that. You're just an ally because you're an ally, and you're not looking for any type of reward, and you're not looking for any type of accolade. But it can't just be in the realm of POC either. There's a lot of intersectionality within diversity and inclusion. We have Black people that are disabled, and we have Black people that are disabled and not different. They have different genders, and they have different sexual orientations, and it gets really convoluted. So if you're going to be an ally, you have to be aware of all of your privilege, and it starts there. And I think once that is established, and once you have a full understanding of how you can move about in this world, and if you have that privilege, you can open the doors for others, it definitely starts there. But it starts within yourself and checking where you have a privilege, because we all have some sort of privilege over another demographic. And that's where I think it begins.
100%. I think that a lot of times we are prepared in education systems from our youth to focus on the skill of whatever we're trying to do, whether it's knowing how to write a release, knowing how to, pitch a reporter. And sometimes we often forget about the interpersonal skills that are required of not only just our jobs, but being a good colleague. Dr. Miles, I know that you did not start off in comms, but I want to know what skills you have gained that you see are transferable across different types of industries and can take you not just with, further in comms, but are just good skills to have generally.
Absolutely. So one of the skills that I think was the bridge to getting me to comms was really about formative research and audience research. It was really about how do we truly learn and understand the people we want to reach. And so that crosses anything. Anytime you're trying to reach someone, be it with communications, be it with intervention, be it as a doctor working one-on-one with the patient, there's that sense of asking questions. We can be experts in many things. I'm deemed an expert in any number of things, but when I sit down with someone, when I want to reach an audience, they are the experts on themselves, and I need to treat them as such. It is my job to use any skills I have to learn about them so that I can help package it in a way that makes sense. And so for me, I think that's the part that's truly transferable, is taking that step back to make sure that anything we're doing, no matter how we're communicating, that we understand our audience, we understand our goal, and we're doing what needs to be done to reach that audience and achieve that goal.
I know we are running a little short on time, but I am a FLAC at heart. And so, Ernest, I love talking to journalists who have come over to the comm side and getting their feedback from the other side. I know I have never been in the journalism field, and so I only see things from a public relations or communication side. what recommendations or advice would you give to students who are going to be working with these journalists every day and in communication with them? What is your best advice for them?
I would say develop a suit of armor, because what I didn't realize as a journalist is how soul crushing it can be when you don't respond to a pitch from a PR person. And now that I'm a PR person, I have pitched some people and I want them to tell me no. Email me back and say, no, I'm not interested. You know, I've been hearing no since I went to a teen jam at Jake Gaither Park in 1977 and asked a girl to dance. I'm accustomed to hearing no. It was good. It was good training for life. But when you don't respond at all, it just hurts me. I never understood that kind of hurt until I got on the other side and became a PR person. And so I've issued an apology to all of the PR people in Tampa Bay for anyone whose pitch did not get a response from me, because now that I'm on the other side, I understand how difficult it can be. And I'm constantly seeking feedback. And that would be my advice to those who are going to be working with journalists. Try to get feedback on your pitches so you can make them better. And I'm still in that process trying to understand, well, how can I just get you to explain to me why this didn't work? If you could just take a minute or two and say, well, this pitch doesn't fit with our philosophy or what I cover, that's going to help me. But to not receive any response, just oh gosh, man, it's a blow to the ego. So I've been developing my armor so I can handle that.
That's amazing. Been there, as I'm sure we all are. This is going to be our last question, and I'm going to again do a little bit of a round robin on this. But the question is, what is your advice to students who want to enter the healthcare sector? What should students be doing now to better prepare themselves to gain access to such a competitive field? And I'm going to start with Kamelya.
I would say get that master in public health, go ahead and stay in school, get that MPH, just stick under your belt. I did not have that. It wasn't my plan. So having to go back and try to squeeze that into my life was tough. So I think that now you guys are in a good place to get that knowledge that you need, because that is one of the things that they like to see on the resume. And then I'd also say look at the ORISE fellowships and build relationships with your alumni networks, because we are here for you, and we're here like right now because we want to support you all.
Juanita, you have anything to add?
Well, you specifically asked in the healthcare realm, and I kind of got here like happenstance. Like healthcare wasn't my goal. I happened to stumble upon in this role, but communications was always my ultimate goal. So I am still doing my field, and like Ms. Hinson said, definitely stick within your networks, utilize all of your networks, and go to every little, whatever there is, whether it's a conference, a meeting, your counselors, just touch base with everyone and push towards that in terms of health. But for communications, I definitely think if you kind of focus in on it, like you said, majoring in public health, that kind of sharpens your skill set. If that is your goal, I definitely think you should sharpen it in the area of communications, especially in healthcare, because we definitely need more diverse voices in healthcare.
For sure. I fell into healthcare as well and it was a steep learning curve. And I think folks often forget just how much healthcare touches and the impact, the real-time impact that it has on people's day-to-day life, and how quickly, right? Like we were saying earlier, everyone is a patient at some point in their life, and you pray and hope for, an in and out situation, but sometimes it doesn't land that way. And as I'm learning through my role in this pandemic, the lasting impact, I think folks are, and Kamelya, correct me if I'm wrong, but we're talking about, what COVID-19 does to you when you're infected, but like, we haven't even got to the point where like, what is it doing to the body after, you have come out of it prayerfully, right?
Right.
So I think that like, part of, and I say all that to say that all of that will be communicated through all of the people on this call in some way and some fashion, right? Like Kamelya was saying, those scientists will rely on the folks on this call to make sure that people understand where to go to get a vaccine, why these vaccines are safe, what they should be doing if they have pre-existing health conditions outside of COVID-19, as Ernest and Dr. Miles are also working on. What does the combination of these things look like? And so communications is reliant on the work that we all do and the work that students coming up and in school right now will have to do. And so it's just super important. And I want to thank you all for sharing your experiences and sharing everything that you guys have done. I know that as a student, hearing from people like you who have diverse backgrounds and unique experiences also helped shape what I wanted to do, but also shape what I didn't want to do. And thank you to all of those who have participated in this discussion centered around the healthcare industry. Looking ahead, the next series is slated for Wednesday, December 2nd at the same time, 4 to 5 p.m. Eastern Standard Time, and we will turn the focus to addressing elephants in the news media industry. So Ernest, you might be asked back. Joining the panel will be a new set of Howard and Florida alumni ready to answer questions. So if you all could please tell your friends to register now. And don't forget to fill out the survey for a chance to win a $25 Amazon gift card. Black Friday is coming up soon. We will put a link to the survey in the chat. And I just want to thank again Hinson, Ernest Hooper, Dr. Miles, and Miss Juanita McLeod for attending. No one's pretending, for attending, but also thank you for everyone who participated today. It's been great to talk to you all, and hopefully we'll see each other soon.
Thanks.